Next, I'm going to be conducting a cranial nerve assessment. During this assessment, you're going to want to make sure that you are able to identify the cranial nerve name, number, if it's sensory, motor, or both, and then you will be also conducting the actual assessment testing the cranial nerve. So first I'm going to gather all of my supplies. The majority of the supplies you will gather from eyes, ears, and some scents available to your patient during that assessment. So first I'm going to test cranial nerve 1, which is the olfactory nerve. This is sensory, in which I'm going to have my patient identify some odors. So if you can go ahead and close your eyes for me. I'm going to place a couple items in front of your nose, and if you could just identify what these smells are.
Coffee grounds. Coconut. Strawberry.
So the identification of 3 of the odors, coconut, strawberry, and coffee, were identified. I am also going to assess for patency. So again, if you can just close one of your nostrils, and if you could just breathe. Go ahead and close the other nostril. And I am assessing for patency. Next, I am going to assess cranial nerve 2, which is the optic nerve. This is also sensory, in which I'm going to assess my patient's visual acuity utilizing a Snellen, Rosenbaum, and Ishihara assessment tool. So first, if you can go ahead, and I'm going to make sure that my patient is approximately 20 feet from the Snellen chart. And with both of your eyes, if you could read the lowest line possible.
L, T, F, P, H.
If you could cover one of your eyes and read the lowest line possible backwards.
H, P, F, T, L.
And cover your other eye and read the lowest line possible.
L, T, F, P, H.
So again, the patient is demonstrating 20/20 vision, OD, OS, OU. Next, I'm going to conduct a Rosenbaum assessment with my card approximately an arm's length, approximately 12 inches away from my patient. And again, if you can go ahead and read the lowest line possible.
L, T, F, P, H.
If you could cover one eye and read the lowest line possible backwards.
H, P, F, G, L.
And cover your other eye.
L, T, F, P, H.
And the patient was able to identify or demonstrate 20/20 vision, OD, OS, OU. Lastly, I'm going to use the Ishihara examination to assess color vision. So if you could go ahead and identify the shape and the color of the shape for me.
A green sweater. A green circle.
And if you could trace with your finger from X to X. And what color was the line you just traced?
Reddish orange.
Reddish orange. And that is the conclusion of cranial nerve 2, optic nerve. Next, I'm going to assess cranial nerves 3, 4, and 6 together. 3 is ocular motor, and that is a motor. 4 is trochlear, and that is motor. And 6 is abducens nerve, which is both. All of these we will be using the 6 cardinal positions of gaze for an assessment technique. I'm going to stand directly in front of the patient, and I would like you to keep your head straight and just follow the pen light with your eyes. I'm noting any nystagmus or drifting. The patient does not demonstrate any nystagmus or drifting upon assessment. I'm also going to I recall I had forgotten to assess my patient's pupillary reaction to light to cranial nerve 3, the ocular motor. So I am going to assess that. If you can just stare directly into the distance onto the wall. I'm going to slowly bring my pen light. Assessing for pupillary constriction to light, in which the patient was able to demonstrate. To assess sharp and dull stimuli of the patient's face, assessing the sensory portion of cranial nerve 5, the trigeminal nerve. So I'm going to get a cotton-tipped applicator. And I'm going to, this is sharp and this is dull. And if you can go ahead and close your eyes for me, and if you could roll your sleeves up and let me know the location and if it's sharp or dull. Just close your eyes for me.
A dull on the top right of my arm. Sharp on the bottom right of my arm. Sharp on the bottom left of my arm. Sharp on the top left of my arm. Soft on the top left of my leg. Soft on the bottom left of my leg. Sharp on the bottom right of my leg. Sharp on the top of my leg. Right. Soft on my forehead. Left. Soft on my left cheek. Sharp on my left chin. Sharp on my right chin. Soft on my right cheek. Sharp on my right forehead.
I will also assess the motor portion of cranial nerve 5, the trigeminal nerve, by asking my patient to clench your teeth tightly. You can go ahead and clench your teeth. Assessing my patient's masseter and temporalis strength. Next, I'm moving on to cranial nerve 7, which is the facial nerve. This is sensory and motor. So I'm going to ask my patient to smile, frown, show your teeth, puff your cheeks out, and raise your eyebrows. You can ask your patient to, you can have them assess their sense of taste, sweet, sour, or salty. However, on this assessment, I'm going to be assessing the corneal reflex. I'm going to have my patient stare directly into the distance. I'm going to shine the pen light off of the patient's nose, identifying that the light falls equally within both of the patient's pupils. Next, I'm going to assess the acoustic nerve or vestibular cochlear nerve, which is cranial nerve 8, and that is sensory. I'm going to utilize my tuning fork and assess my patient's auditory acuity. So I'm going to use my tuning fork. I'm going to make sure that I hold the tuning fork at the very base. I'm going to strike the tuning fork and place directly on the middle of the patient's forehead, making sure that the patient is able to hear and feel the sensation equally in both ears. Let me know when it stops.
Stop.
Were you able to hear and feel the sensation equally in both ears?
Yes.
In the case that the patient was unable to hear or feel the sensation equally in both ears, you would assess the affected ear by conducting the Rhine examination. So I'm going to utilize my watch for an assessment of time while I place the tip of my tuning fork on the mastoid process. Once the patient does not feel the vibration sensation anymore, I will move the tuning fork to the front of the ear and have the patient let me know when they stop hearing it. The air conduction to bone conduction should be 2 to 1, so they should be able to hear the vibration twice as long as they would be able to feel the vibration. I'm going to go ahead and get my second hand ready. And let me know when you stop feeling the vibration.
I stop feeling.
Note 12 seconds.
I stop feeling.
Note
Or hearing.
28 seconds. So the patient was able to have 2-to-1 air conduction to bone conduction. I'm going to assess using the whisper test. So if the patient can cover one of their ears, I'm going to whisper 2 words, and if you could let me know what those 2 words are.
Apple, banana.
And cover the opposite ear.
Orange, pineapple.
Next, I'm going to assess the patient with the Romberg exam. So if you can go ahead and stand up for me. I'm going to have my patient stand with their arms at their side. And if you can go ahead and close your eyes for me for 20 seconds. I'm going to stand next to the patient, making sure I maintain safety. I'm noting if there is any swaying. There should be minimal or no swaying noted in your patient. Assessing this for a full 20 seconds. You can go ahead and open your eyes for me, and you can go ahead and take a seat again. Noting that there were no very minimal swaying noted on the patient during the Romberg test. Next, I'm going to assess cranial nerves 9 and 10 together. 9 is glossopharyngeal and is sensory and motor, and 10 is vagus, and that is also sensory and motor. I'm going to assess my patient's soft palate and uvula movement. So if you can go ahead and stick your tongue out for me and say ah. And I'm noting that the uvula rises and falls equally and smoothly. I am also able to assess my patient's gag reflex at this time. You do not have to physically conduct this assessment, but you will need a tongue depressor. I will have my patient stick their tongue out for me, and I will slowly enter the patient's mouth with the tongue depressor slightly on either side of the middle of their tongue until you are able to assess a patient's gag reflex. Next, I'm going to assess cranial nerve 11, which is the accessory nerve. This is a motor examination in which I'm going to be assessing the patient's strength. So I'm going to have my patients shrug your shoulders for me. And if you can turn your head from side to side against my hand. Testing strength in the sternocleidomastoid and the trapezoid. Lastly, I'm going to assess cranial nerve 12, which is a hypoglossal nerve, which is a motor assessment. I'm going to be assessing the ease and quality of tongue movement and the strength of the patient's tongue. So again, if you could just stick your tongue out for me. And if you could just push your tongue to the inside of each of your cheeks. And the other side. And that is the end of cranial nerves.